Hi. So I have a very brief period of time to reflect on key points that came to mind. And so what I'm going to do is resonate with some of the points that were brought up by the speakers, and also try to relate it to the practice that I'm involved in, which is providing support to students in the school system. Increasingly, the students that we have referred to see us at Poppart are students who have ASD and comorbid mental health concerns. And one of the issues, for example, that was brought up was around the diagnostic overshadowing, and we get many questions from school staff. Is this ASD, or could there be something else going on there? And often that we will see significant behaviors that, you know, for an outsider, looks like something much more than ASD. And so something we often encourage is asking, has anything changed? Is this different from before? Have things escalated? But we do see that frequently, that the hesitation to diagnose or to consider mental health because the student has ASD. Something else that we see, and I just kind of made up this term, is what I would call treatment overshadowing. So and what I would say about that is when there's students with ASD who have a significant mental health concern, it could be debilitating anxiety or depression or OCD or suicidal ideation, etc., and they're being denied access to services either within the school system or in the community or in child and youth mental health or with public community supports because they have autism. And sometimes or often what I'll hear is, well, they have ASD and they're getting X, Y, and Z support. These supports are for students with other diagnoses or other categories. And I understand services are tight, but it is quite frustrating. We often, our Poppart consultants are in a role where we will be advocating, we'll be working with the school system and the family, and our consultants have got on the phone to community mental health, to a physician that's working with the family, and try to make those connections, because we know that it is really crucial that these kids get the additional support for their diagnosis apart from the ASD. Something that was mentioned was the contribution of the environment, and several people have talked about that. It is very important, but something that I encourage that we ask is, who are our partners? Who else is working with or could potentially work with or could partner with us? And I would like all of the professionals, whether they're in school or health or working with children and families, to think about that, because we can certainly do a much better job if we have a wraparound support. The idea of having parallel supports being put in place in addition to for example, students struggling with depression, but they may also have social isolation as a student with ASD. And so we've done some work in the schools. For example, a recent study that we're going to be presenting at the Geneva conference in a couple of weeks was targeting social skills with the PEERS program. There were some students with ASD who had comorbid depression in that group, and one of the unexpected outcomes, we weren't targeting it, was decreased in depression symptomatology, along with increased social interaction and decreased social isolation. So it is really important with the comorbid diagnosis to keep both of those things continuing, as well as support from speech-language pathologists and the other professionals. The gold standard treatment that's been mentioned tonight for depression, anxiety, OCD, etc., and mental health, consistently, there's a gold standard for typical individuals, and it's interesting that same gold standard is for individuals with ASD, which is certain medications and CBT and varieties of it. But something that I would like to emphasize is, because I have, in my experience, encountered many clinicians who are quite hesitant to work with individuals with ASD, is I think it might be helpful for them to be able to increase their confidence and their comfort level if they in fact get additional training beyond their knowledge of evidence-based practice and how to treat mental health, which is understanding the adaptations, the environmental supports that can take place. Because there are some unique needs depending on the developmental level of the individual. It's a huge topic. It has been touched on by the presenters, but considering things like how do you support communication processes, especially if you're using a talk therapy, how do you provide options that may be other than talking or face-to-face, how do you support the individual's difficulty with change, need for predictability? And there's lots of things you can do that will increase their comfort level and yours. Another huge one, and I'll end with this, is theory of mind. Because if you're working with an individual, and especially using something like CBT, where you want them to, let's imagine or let's consider a possibly different interaction between a situation and thoughts and feelings, if you can only consider your one current interaction, that's quite challenging. So I myself have used a lot of supports for developing and teaching theory of mind, using role play, drama, demonstrating around the room 3 or 4 various people having very different reactions to a same situation. And reinforcement for the kids, but also for yourselves, because it's hard work for everyone involved. Thank you.